Hi, everybody. My name's Tracy Griffiths, and I'm with some friends here who are helping me help all of us be opening our IPSB at Life Energy Institute Massage and Bodywork School. I've got very dear friends here, Angela Brown, RN. She will, we had a great conversation last week, and I thought it would be great to have her express how she is as a nurse at Cedars-Sinai Hospital, working with the public in a safe way in the hospital setting. And this is a big conversation. It's just the beginning. And I thought this would be a great resource for our staff and our students to be coming into IPSB at Life Energy Institute, opening up our doors and walking into that space that I consider part of the healthcare industry. So I'm wanting to share these resources with you. We also have Leslie Prell here, one of our senior instructors at IPSB. And we have Christie Deddens, who is a very dedicated and senior massage therapist and instructor and has been in the healing arts for a long time. And she's back to work and she's got some resource. So before any further ado, let's go with you, Angela, and please introduce yourself with a little more of where you come from, your background, and then let's dive into that conversation that we were having the other day.
Okay. So I'm Angela Brown, and I have over 25 years in the nursing field, primarily in acute care settings, but my beginnings started in the military. I went to their licensed practical nurse program. And also just through going through that experience, you learn to pay a lot of attention to detail because it's something that's very much expected of you when you're in the military. Everything has its place and et cetera. And you definitely learn a appreciation for the chain of command and camaraderie and the expectations of you having a buddy. You're always assigned with a buddy, someone else that you're responsible for. So I think they definitely ingrained some certain thought processes in my head when I look at things as to how to be a buddy to people and how to live up to those expectations. And then also just that, again, strong attention to detail. And after that, I went on to do my registered nursing degree, and I've worked in hospice, I've worked in physician offices, I've worked in the hospital and ICU settings where patients are very ill on ventilators, which is like a high talking point right now through this coronavirus situation. And currently, I actually work in perioperative services, so taking care of patients before and after surgery. And certainly, obviously, doing that in a hospital setting. So that's become quite interesting and different and challenging over these last several months with the, social distancing factors, wearing a mask at work all day, and like the difference it makes in communication alone. Like you sound muffled, you can't hear you can't hear your patients well, you can't hear your coworkers well, so there's that potential for misunderstanding or misinterpreting what another person's saying. And then I'm sure everybody's seeing about the mask. I saw a cute little term the other day for mask acne. So there's those things that are happening to all of us, having reactions to the materials of the masks and just our body reacting to having that surface covering our face, and we forget how much emotion is intuited by being able to see someone's whole face. So that again creates communication barriers as well. People can't really tell your emotions either. So it's been challenging lately, but rewarding as well. And I'm open to answer any kind of questions you might have about that process, about what's going on or how I see those things. Oh.
Yeah, when we were on the phone the other day, and this is the mindset that we're entering in, how to be in the world with COVID safely and to follow the protocols that were, and this is where Christy will come in as well. And you, Angela, too, how you've been keeping yourself you're in the hospital and you have more PPE requirements, you know, personal protection equipment than we do as massage therapists. Yet, you know, we see businesses, Christie will talk about her business and what her sister does as well, and they're not getting sick. You know, they're staying well. And the protocols that we'll be placing at IPSB, we're going to have a whole protocol, and that's not what this recording is right now. It's really the mindset that I'd like to talk about, and the consciousness of us being, and this is what you were talking about, Angela, the integrity of really being truthful, like where you were, were you in a big crowd? Were you careless? Was there someone around you? So can you talk a little bit about that and how you're upholding that integrity?
Well, for me, of course, as a frontline care provider, as a healthcare hero, there is a high expectation that we, even outside of work, continue to promote those behaviors that are going to be safe for society. And I know that I don't love wearing a mask. I have to go to work and wear it for 12 hours, but I do that as a part of my job and as a part of who I am as a healthcare provider, because I have to take care of other people. I can't just think about me and what's good for me, what makes me happy. Yeah, if I could, I would not wear a mask. If it was safe, I would not wear a mask, but it's not safe because there are people out there that are asymptomatic. They don't have any symptoms, but they do turn up positive. And granted, the majority of people we see are definitely not in that category, but there has to be some social cohesion. We have to accept that our behavior also affects others. And if I don't wear a mask and you don't wear a mask and he doesn't wear a mask, then we're not protecting anybody, and we're not protecting those people that are most vulnerable in our population. So there needs to be a social buy-in as to this is what's good for everyone for the time being, hoping that this is just a temporary blip in our history. But it is also interesting that we've had similar outbreaks, but not to the extent of COVID. And it surprises me that people aren't taking it a little bit more seriously. Like we had H1N1, we've had all the MERS and SARS, and all of these things have occurred in my 25 years of nursing. Actually, the majority of those have been in like the last 10 to 12 years. And we've never before had that virus, like H1N1, keep coming back up and rearing its head. And we've had these weird surges throughout the country. And it makes you realize that not everybody is buying into the social welfare aspect anymore. And it concerns me deeply that that we here in America can't come together on at least one thing, and that is our health and protecting one another from this potentially lethal virus. It's really not age discriminate. When I look at the numbers, there is about a 20% of each age range, ranging from 5 all the way to above 80. When they break it down at our graphics at work, everybody's about 22 to 28%. Of course, the older generation has that higher percentage, the 28 to 30%, and they're, of course, unfortunately suffering the greater losses because of comorbidities. And it's challenging, I think, and there are a lot of things that we probably need to change in order to make people healthier. And like with us talking here, massage therapy and alternative therapies really do have a place in making people better. And what's been working for me is, like, I use my oils, and I haven't changed anything in my routine as far as how I clean my house or how I take care of myself. I do my usual routine with my thieves and my Life 9 and my probiotics, and taking care of myself in more of a healthy way to try to keep from getting sick, or as sick as some people are getting, even in my age range. So that's kind of like where I am. I don't know if you have any other like specific questions. I know I kind of.
I'll just pause for a second and see if Leslie wants to ask anything or share something. One of my intentions was for people to also hear you talk about like how close you really are to people at work, and you're, you know, are you seeing a lot of coworkers also staying healthy right along with you? So that's one little thing we can talk about. And I'd like to, do you want to ask before that, Leslie? You're muted, babe. You're muted. Go ahead. You're muted, Leslie.
Yes, I was muted. Thank you so much for coming out and helping us with this, Angela and Christie. There was something that you said, apart from, you know, COVID, apart from the health and well-being of practitioners and students, that I found really interesting, that has a lot to do particularly with the type of classes that I teach, which are very emotional in nature, and the fact that people will be wearing a mask and not being able to see and maybe connect in the same way emotionally. And you know, the face and mouth, the holding of the mouth, and the tilting of heads, and is very insightful for me as a teacher. And so I'm curious as to how I'm going to be in the classroom, you know, without that benefit of sight. So how I'm going to be able to, what other skills will come forth as a result of that. So I found that a very interesting little tidbit, and I wrote that down. So thanks for bringing that up.
Of course. It's actually been a little something that some people have kind of been working with at work, in those areas where they are taking care of patients, where the patients are in isolation and the nurses have to come in with like a mask and like another visor over top of it, etc. They've actually taken pictures of themselves, like in their personal life or whatever, and laminated them and like put them on their bodies so that the patients could see at least a baseline what that person really looks like without all of that gear. And then someone went as far as to find a way to make some masks where they put like a clear plastic inside, and so you could see. But yeah, definitely you lose a lot when you don't have that full facial ability. It's a really big part of our communication as human beings, reading one another. So yeah, it does make it challenging. For me in my practice, we obviously get pretty close to patients. I mean, we have to start IVs. So I will say that at this stage in the game, we are testing all of our patients that are having surgery. So we know at a baseline where they are. We are separating any patients that have coronavirus. They go to a separate operating room that we don't use for any other patients. It's heavily cleaned afterwards. Those patients don't come into our pre-op or our recovery area. They go straight, you know, from their room to the OR, back to their room. So we really, really minimize the interaction of anybody that's positive with anybody that's negative. Even though our patients are tested, we're all still required to wear a mask within the hospital. Every employee coming in every day gets screened for a temperature, and we are required to wear that mask at work at all times. For me, for lunch, I go outside so that I can sit far enough away from people to have my lunch. Right now, it's been pretty good because the weather's been agreeable with that. But, you know, we also at work, it can be challenging at times to also continue to maintain that social distance between each other. And in a way, it's kind of, I don't mean to sound like we shouldn't be distancing, but it becomes a moot point when, you know, when a patient has a lot of physicians and nurses around them at a time, or there's just certain times of the day when it's so many staff in the area that we just can't really maintain that distance. And when you're starting IVs on patients, you're within 2 to 3 feet of their face. But again, we're continuing to wear our masks. And, you know, I wear glasses most of the time at work, so I have some sort of eye protection. But that's also something to be mindful about when you're in close proximity, even though, you know, people appear well and they're wearing a mask, that if you're a practitioner working with someone, you know, it's an additional piece of equipment you may want to consider having handy. The other thing is like you have to rely, like especially for you, you'll have to rely heavily on people being truthful about where they are health-wise at the time, because, you know, they're not getting tested before they come for a massage. They're not getting tested before they come to do a class. And so those are instances where you really have to hope that people and encourage people to really be honest about their health at the moment and how they're feeling, and if they think they've really been exposed to anyone that might be ill.
I'd like to talk about that.
Yeah.
And that's a good point. That's a really good point. The spa that I'm working at it's a nationwide spa, and they've been in operation, or they've been open in other states for quite some time now. So they've had a chance to kind of work out some of the bugs and the kinks, and they have a very strict protocol that's in place. Very, and you know, I had to go through a 2-hour course in it and all kinds of stuff. And so far, so good. And it's been interesting because, you know, you're right in that you have to rely on the client to be truthful, but I'm finding private practice, because I've been going out for a little while now in private practice, that people are very on board with this. They don't want it. They don't want to, just as much as we don't want it, they don't want it. They're in some ways adhering more to it than I might do even. It's like they're way on board. And it's a good thing. And so by adhering to this, and I have a twin sister I live with who is frontline in grocery stores. She works in a grocery store, and it's been months now, and no one in her grocery store, since they've had protocols, has gotten sick. And it's an interesting thing. And what I do notice is that at first I was kind of fearful to go do this, but the more and more I do it, the more I feel like it's sort of like a second nature after a while. I mean, I don't know if you find that in healthcare, that you're starting to find that, yes, sometimes you have to be in close proximity, but you're starting to find a way to navigate with this. And it feels more comfortable in time. Like it starts to feel more like, you know, I think I got this. I think we can do this. And they're showing that if you do wipe all the surfaces down, if you do wear the proper gear, and I tend to, in some cases, wear a face shield as well, just because I don't touch my face. It's kind of nice, you know, like it really prevents me from touching my face. And I do often wear goggles as well. But it seems like, you know, we're getting kind of the hang of this, and it's starting to work.
Can I ask a question I guess this would be directed more towards Angela, because you mentioned wearing glasses. I wear glasses all the time. Is that as protective as a shield?
Well, of course, a shield is going to give you a lot more protection, because it's going to come around to the sides and everything. So you'll get more of a coverage with that. But it all depends on your comfort level and your, like, how you feel about the status of the person you're working with or the people you're around.
Thanks.
Christie, you said something when you were, that prompted me to get you on this call today, and maybe Angela can like go back into that as well, about once you got in there and you learned the protocols and everyone around you was a little like less fearful. Can you talk a little bit about, like, once you do it, you had a great quote. I thought I wrote it down. Well, the kill rate outset, not the case. Like the fear was removed once you gotten most?
Yeah, well, I want to back up because it's interesting when the first the shutdown happened and we weren't going in home to massage people or go, or even my spa closed down. There was I worked for a mobile service that was partnering with another healthcare company. And the first thing, I was just as panicked as anybody else to go outside, like, I don't know if it's okay. Are we going to be able to do our profession again? And then they sent me to these, they came up with this idea of going to, this was for Walmart as it turned out, and going to their distribution centers and teaching the employees how to stretch and do myofascial or like just soft tissue work on themselves so that they could deal with their aches and pains because they're working very hard. But we were doing it at distance. And when I first went, I was not feeling great, and they weren't doing as great a job at distancing, and they were onboarding a lot of people. So I was like, I don't know if I want to do that again. And then they quickly ramped up the protocols, and they were doing the temperatures at the outs, right when you walked in and anytime you left, and they were wiping everything down. And suddenly it's like, well, I would go and ask, and they'd say, no, we're not getting any cases. In fact, and then they had like one person they caught at the door and they didn't come in, and nobody was exposed. And suddenly it became, this is kind of good to be working. I like this. And from that moment on, my fear, that really acute fear, went away. And it hasn't returned. It's like, it's not that I'm not afraid of getting sick. It's that it's on a more reasonable par of where it should be. And I am now looking forward to going to work. And it's interesting because at the spa, I found that I was doing the training for this protocol, and that a lot of the therapists had been isolated for a long time. And when they came in, they were all sitting in a corner like, what are we doing here? And we started going through the protocols, and then we had a moment where everybody could kind of share where they were at, and they were all pretty frustrated and anxiety. Like, do they understand what they're asking us to do? And I'm like, yes, they do. That's why we're doing this. By the end of, I think it was a 4-hour training session, by the end of that, people were kicking back. They were feeling good. They were like really glad they came in. And now everybody's really looking forward to working. And it's an interesting thing I've noticed that with a lot of people, that you kind of need to circulate a little bit to sort of get that muscle back up, Does that make sense?
Thank you. Yeah. How about you, Angela, and your mindset for working and staying well? And I love what you said about really taking this seriously. That's really the broad title of this, IPSB at Life Energy Institute. I'm considering a healthcare profession, and like walking through those doors is to be in integrity with what's at hand now. So how are you in your mindset when you're working?
I think kind of what, to go off of, I think a lot of people are still living in a sense of fear. And it is true that the more you get out and you expose yourself to, life, not by not wearing a mask, but getting out there and doing the things that you normally would do, that you start to break away at that fear. But there's definitely been, and I still have a few coworkers that are kind of still living in that sense of fear. And, but I myself, because I have ventured out beyond Los Angeles and actually was in Arizona a week before things started to get serious, and up to Mount Shasta and things, is that the majority of people are wearing masks. The majority of people are respecting the social distancing cues. And by going out and kind of living a little bit in this world, it's also brought me back to work to feel less fear about taking care of people and feel less fear about the whole situation. Although I am definitely hopeful for a change to go back to normal and not, for us to not have to wear masks and for us to actually be able to engage one another like we used to and feel more confident about those interactions. Because, it's hard to not hug people that you see all the time, and it's hard not to have those social interactions. And I think it also leads to some social isolation. Even though you're still seeing people, there's like that lack of touch, which is a huge part of the human experience. Like we were saying, sight and being able to see one's face and read their emotions that way. And then you take away also that that connectivity and add that distancing. It's another whole thing to deal with. Yeah, I'm not.
That's good. Any final thoughts or questions or things to add, Leslie, Christie, Angela? Like I said, we will be putting together, a step-by-step. Everybody will know everything. It's almost done. I envision a video for people to watch. But, to be continued, I'm sure. Maybe Christie, as you go along in your protocols. Yeah, go ahead.
Well, I was going to say, leading off what Angela is saying, it's like, it's true. I mean, keeping people healthy is going to help us lick this thing. And we have a role in that. And it's really important. And I think I've gotten really more connected to that as time's gone on, and that you keep people healthy, they're going to survive this thing, or they're going to blow it out of the system. I think it's going to get better. Yeah,
that's what we stand for.
Yeah.
Being healthy and helping people become empowered in their health care. And we're as a massage therapist, as a nurse, as an instructor, we are educators, and we're setting the example for our immune systems and doing the right things. And, the social cohesion within IPSB at Life Energy Institute is what I'm calling for in our behaviors and how we navigate through and not let this stop our lives. But I believe, and if maybe you could just say, do you believe, Angela, that we can have our lives healthfully with protocols?
Yes, definitely. I think that there are challenges and things that are uncomfortable and unfamiliar about, having to wear a mask all the time and being mindful about, oh, I just got out of my car and I'm going into the store. I better make sure I have my mask. And when I get back to my car, I want to make sure that I take care of my hands. And I don't mean to get off on one of my things that drives me nuts, but it always interests me to see people wearing gloves and doing their things, shopping, etc., and then reaching into their purse or their bags with their gloves on, and then like all of these things, and then they touch themselves, and I'm like, what was the purpose of the gloves? So I just want people to be mindful about, like, wear your mask properly, and if you're going to use protective equipment, make sure that you use it properly, that you dispose of it properly, and that you clean it as needed. So like if you are wearing visors or glasses and things like that, that you also remember to clean them frequently, and then hand hygiene. And I think that hygiene is much better than wearing gloves. If you're just more mindful about whenever you touch anything that's not in your house and that's not a part of your little realm, that you should use hand sanitizer. Carry it all the time.
Yeah, it's been so interesting. These are now becoming sort of second nature to us, right? I don't mind wearing a mask, but I'm not wearing a mask for a 12-hour shift. So my clients who I do see here at my house, they grumble about the mask and the face cradle, but they wear their mask, and they understand that their health and my health are important, and we respect each other accordingly. Something that I just want to touch on is we realize that it's the droplets that are most concerning, and surfaces maybe are less so. We have a lot of surfaces at school that lots of people touch. Can you talk about that a little bit? How do you do that at the hospital? And Christie, how do you do it at the spa? Like, how do you keep common surfaces clean? What's the protocol behind that?
I can go first because mine's probably less. They are limiting where clients can touch. When they come in, they have to put their belongings in a covered bin, has to be covered. County of Los Angeles is mandating that. And then they're told which surfaces they can actually put things and touch in. But even after that, just so you know, that the tables have a vinyl covering over the bottom now that gets wiped down in between, after you take all the sheets off, gets wiped down with a natural disinfectant that you have to let it sit for 10 minutes. That's the kill rate. And so we're altering rooms so that we can do that. And then what happens is we have to wipe down all the things that we've touched. We have to wipe down the counters. We have to wipe down all the knobs, the bolster, the actual table itself, the doorknobs. All that stuff has to get done each time. And then they do actually walls a couple times a day. Someone else does it. I don't have to do that, which is great. And then when it comes to like the front counter, they have sneeze guards and they have whatever, and they're not allowed to touch product or anything like that. But that's how we're doing it. And it seems to be working in all the other spas, which is great.
So for us at the hospital, I know this is probably going to sound awful, but because we have A, tested all of the patients, and B, everyone that is at work that day is presumed to be healthy, and we've gone through our temperature screening. Generally, first time of the morning, we wipe down all the keyboards and all of those kind of things. But I'm going to be honest with you, the patient area where the patient comes in, that area is highly cleaned. The beds and all those things, we have, our hospital grade products that we use for cleaning all of the gurneys and things like that. And of course, clean sheets go on and stuff. And our patients are very much in a limited contact situation. We bring them in, they may go to the bathroom, and then they go to a curtained off bay, which is where they stay unless they go back to the bathroom again. So their interaction and their potential to touch lots of surfaces is very minimal other than the bathroom. In the bays where we take care of them, when the patient goes to the operating room, all of the cables are wiped, all of the keyboard is wiped, the seat that the nurse sat in, or maybe the patient or whatever, like anything in that bay is wiped down. As far as our work surfaces, it's kind of a hit or miss situation. Unfortunately, it's just, there's so many people in and out, doctors, nurses, nurse practitioners, residents. There's just so many people that like wiping down every surface would be like an all day affair. Like somebody would have to be there all day. So it kind of just comes down on us to, again, make sure that we're really consistent with our hand hygiene, that we're wearing gloves when we really need to, and disposing of them when we, like not touching and cross-contaminating things. And pretty much, most of the equipment we use is single-use equipment for the patient. So we're not taking a lot of stuff to the bedside that we have to then turn around and clean off. Like if, certain things we do, equipment if we bring in to do certain things, but it definitely at a facility like massage place, you're going to have a lot more protocols to follow.
Yeah, in fact, when we take the bedding back to the laundry area, we're going to have it enclosed. Used to be you could just take it in the back, and now everything's going to be enclosed as it gets transported.
Thank you. One of the things that we're looking at that pretty sure we're doing is having a linen service so that the students aren't bringing in their own linens. We'll have it all provided. They'll come take it away and launder it and bring it back. And those like enclosed little cubby things, we're putting all that into place as well. Anything else, you guys? What do you think would be more helpful in this moment, Leslie? I feel you're like wheels spinning here to add to or ask or just bring into play with?
I'm curious about the vinyl covering on the massage table.
Yep.
What's
your question?
Like, where did you get it? And like, what
Amazon.
Is it a fitted thing?
Yeah, it's a fitted sheet. It's a fitted sheet, and there's the face cradle. Energy makes it.
Interesting.
Maybe you can like send me the link or whatever.
I will. I just ordered one for me.
And then do they have it for the crescent cover as well?
Yeah.
So and they're reusable. The vinyl thing is reusable.
They are.
Wow.
Yeah.
And
they're
then,
really cool.
And then what kind of disinfectant are you using?
They're using Decon 24, not Decon, what's it called? I'll have to find out. I'll text it to you. I've obviously mentioned Thieves, and but this is something that they've used in their nationwide protocol, and I'll let you know it is a natural.
Because Thieves is not good for the covering on a massage table, but we, who cares about a vinyl thing that we,
right.
We can, degrade that, and then, so maybe Thieves is a way to go.
Maybe.
That would be amazing.
Like, I love it how when people come together, they get inspired to hear that one little thing that you think is like, huh, everyone knows this. And then you're like, what?
No, these vinyl covers were really, really hard to get a hold of.
I bet.
And then now it's getting a little easier. I think you can actually get one maybe by the end of the month.
Okay.
I'll also check. I'm sorry to interrupt. Go ahead.
No, go ahead.
I for some reason, Meyer Distributing Company 30 years ago thought I was a chiropractor. I never told them I was, but they think that I am. And I get a lot of things at cost. I will check with them to see if they have a vinyl situation for massage tables, because they have everything for our, for everyone, acupuncturists and chiropractors and all that stuff. So
that's cool.
See what we can do about that. Okay, so I'm going to write that down. Vinyl fitted sheet.
So Angela, as a frontline healthcare professional, talking to body worker therapists, massage therapists, what else would you want to share with us for us to be better at what we're doing in the realm of being safe during COVID? Like any last tips or anything?
I don't think I have anything new to say about it. It's just, of course, try to work on your ability to, find ways to connect with people differently, as we said, because you're not going to have those emotional cues and some of the physical cues that you may have had before. And then, of course, just being mindful of your distance and hand washing and your mask wearing when you're going to be out and about and in public settings in close proximity. And, taking care of yourself, too. Make sure that you're doing your due diligence, drinking plenty of water, which is kind of something that you kind of forget about when you wear a mask. I noticed when I wear a mask for 12 hours at work, I don't get as thirsty because you're constantly humidifying yourself. So it's really important to remember to drink some water. And because when everything is moist, your body gets rid of germs better. Like when your cilia is working, it's helping get rid of those irritants and bad bugs and viruses and bacteria that you're getting in contact with. So hydration is really key in states like this where we're dry primarily, and when you're wearing that mask, you just have that loss of consciousness about how you're really not as moist as it feels.
That's great to hear. I totally forget to drink more. It's wild. That is so key. Thank you.
Anything you would want to add to be complete, Leslie, with a thought or a idea or something on your mind to share with me?
I will say last week was the first week that I kind of went, this could work. And now I really feel like we're going to find ways to make this work. I particularly because I'm listening to someone like Angela, who is in a hospital, and she hasn't been ill, and Christie's sister, who's been in a grocery store on the front line for 4 months now, has not gotten ill based on like what I consider like fairly no-brainer things, like don't touch your face, wash your hands, like almost an obsession, and wear your mask, and if you can social distance, you do. So it'll be an adventure. and hopefully one where it's safe for everybody, our students and our faculty and staff. So I know that everybody has been working very, very diligently and consciously and carefully for us to reopen safely and with as much love as possible.
That's beautiful. It is true. Thank you, Leslie. How about you, Christy? Just to be complete with our conversation, any like bit to be complete with?
There are more protocols that I will share with you if you want, of what we're doing, and so if that's helpful. But by and large, if you the main points, if we just do that, we can do this. We can and it's not like we're saying no one will ever get sick, because that can happen. We're not ignoring that fact, but it's a very, very small likelihood that could happen with these protocols. And then if we even have protocols that if it does happen, what do we do? And we can work with that. We can totally work with that, but we can do this.
I love it. Yeah, we can do this. So our next talk, maybe, Christy, we get into those nuts and bolts and bring you in with, if it's okay, with our office protocol, Sabrina Roberson and Kat Damiano and Gary and our staff. We're putting this together, and it's so good that you're in the field with a corporation that's like high-end, up-leveled, Uber, and that's how I want to go forward. Just like, why not just go for it and be the best we can in all of it?
And I do want to mention that I am also going to be working in an acupuncturist's office doing, I'm going to be doing lymphatic drainage massage for her. But we had to go through the protocol of what they do in their office, and she's been functioning for a good long time. I think she never ever shut down, and they're doing fine. So
we need to hear stories like this too, to balance out that pendulum swing is like way over here or way over there. It's like, wait a minute, let's be in our good way with our information and our education and what we're here to do. So thank you so much. Thank you, Angela, for spurring this conversation. And we may ask you to come back for more, if that's okay. We love you. Yeah. And Angela also teaches Urban Zen Integrative Therapy. And so I would love that space at IPSB to be rolling out their mats for your classes. So more on that. And Christie Deddens, thank you so much. You're such a wonderful being. I love you, and great resource. And Leslie, having you here today was like key. So from here, maybe there's more that we can collaborate on to bring more to our community. Thank you so much, everyone.
Thank you.
Thank you, guys.
Thank you.
Thanks, Tracy. Thanks for inviting me. And if I can get invited on that Christie call with the staff, I would love to do that too.
We'll put that together. Absolutely. Yeah. Thank you so much.
All right. Enjoy the day, ladies. And I'll see the two of you later on.
Yes.
That's right.
Okay.
Bye.
Bye, everyone.
Bye.
Thanks, Angela.
Oh, of course. Thank you for having me.